Hello guys, this is the last video of sclera which is staphyloma. So first we'll see what is staphyloma. It is localized bulging of the weak and thin outer tunic of the eyeball which may be cornea or sclera. So we have seen in anatomy that cornea forms the anterior 1/6 of the outer tunic where sclera forms the posterior 5/6. If there is localized bulging of any of this due to weakness, it is known as staphyloma. So due to this weakness or thinning of the sclera or cornea, the uveal tissue present underneath it will shine through it. Let us quickly go through the types of staphyloma. So first let us see this diagram on staphyloma. So the staphyloma may be anterior, intercalary, ciliary, equatorial or posterior staphyloma. The anterior staphyloma refers to the ectasia of the pseudocornea, not the true cornea, the pseudocornea. So this pseudocornea, it is formed due to corneal perforation. This is intercalary staphyloma which is present at the limbus of the eye. The ciliary staphyloma is present near the ciliary muscle, which is 2 to 3 millimeter away from the limbus. Equatorial staphyloma is present near the equator, whereas the posterior staphyloma is present behind the equator. So now let us see about each of them and their causes. The anterior staphyloma, it is this ectasia of the pseudocornea after sloughing of cornea. So when there is a corneal ulcer, if it involves more than the like Descemet's membrane, it will lead to perforation of the ulcer. So there will be sloughing of cornea, and after the sloughing, there will be formation of pseudocornea, which is a scar formed by the organized exudates and fibrous tissue covered with epithelium, with the iris plastered behind it. So this layer of pseudocornea will cover this corneal perforation, leading to formation of a weakened area, which will further form the staphyloma. Intercalary staphyloma. Intercalary staphyloma is localized bulge in the limbal area which is lined by the root of the iris and the anterior-most part of the ciliary body. So we have seen in this diagram that this is the intercalary staphyloma. So at the limbus there is iris and anterior-most part of the ciliary body. So this staphyloma will be lined by the iris and the anterior-most part of the ciliary body. So it is due to ectasia of weak scar tissue at the limbus after healing of perforating injury or peripheral corneal ulcer. So if there is any perforating injury or peripheral corneal ulcer at the limbus, then after the healing there will be formation of a weak scar tissue, and due to this weak scar tissue, since it is weak, therefore there will be formation of staphyloma or ectasia. There is defective vision due to corneal astigmatism in case of intercalary staphyloma. Now we'll see about ciliary staphyloma. Ciliary staphyloma is the bulge of weakened sclera lined by the ciliary body. So the ciliary staphyloma here, as you can see, will be lined by the ciliary body. It is present 2 to 3 millimeters away from the limbus. The perforating injuries, scleritis or glaucoma, which may be developmental, primary or secondary, are the causes of ciliary staphyloma. Equatorial staphyloma, it is the bulge of the equatorial sclera near the equatorial region which is lined by the choroid. So in equatorial region, here the staphyloma will be here. This is the equatorial staphyloma. It is lined by the choroid. That bulge of the sclera lined by the choroid is known as the equatorial staphyloma. Scleritis, degeneration of sclera, and in pathological myopia or chronic uncontrolled glaucoma are the causes of equatorial staphyloma. Posterior staphyloma. The posterior staphyloma is a bulge of the weak sclera lined by the choroid behind the equator. So posterior staphyloma means behind the equator, and it is lined by choroid. Causes of posterior staphyloma include pathological myopia, perforating injuries, and posterior scleritis. So, how to remember these causes of each of these? So, everything will be caused by perforating injuries is common for everything. whereas in case of intercalary it is due to peripheral corneal ulcer. In case of ciliary, we can remember that it is due to glaucoma or scleritis. In equatorial also, in ciliary and equatorial it may be due to glaucoma, and in ciliary, equatorial and posterior staphyloma it is due to scleritis. In equatorial and posterior staphyloma it is due to pathological myopia, including all of these. That was all about staphyloma. Thank you.